Thank you everybody for joining us today for Indian River County's May 8th update on COVID-19. Today you will hear from Indian River County Sheriff Darrell Lohr, County Administrator Jason Brown, County Health Officer Miranda Hawker, and also an update from Corey Richter to provide an update on the local hospitals. Everyone will be available for questions after their presentations.
Thank you, Brian. And my message today, first and foremost, is again, thank you to our first responders, thank you for our healthcare workers, and most importantly, or as important, thank you to our residents of Indian River County. We've made this journey together, obviously, and I recall several weeks ago when we were up here talking about the safer at home and the stay at home order from the governor's office, and now, most recently, phase one. And I will tell you, and under Mr. Brown's leadership and the leadership team throughout this county, our residents have behaved as we've expected. Everything has been tempered. Everything has really been a success. Mr. Brown will talk earlier about some of the other openings that we are doing, and he particularly is deciding on the county facilities, which is truly awesome. It's a unique county that we live in. We see our friends to the north and the south that are doing other things, but I certainly want to thank and the patience that we have with our residents in the county. That's what's making it work in Indian River County, quite frankly. So on the law enforcement side, we're extremely busy. Many of you know that we've been not only patrolling our 22 miles of river and beach. Last week alone, on Saturday and Sunday, we had over 100 contacts with boaters. Please remember the 50 feet distancing when boating. And again, no docking or beaching on the spoil islands. We ran off about 100 of those 200 over the weekend simply from congregating on the spoil islands. So we've got a good thing going. We don't want to lose that. Be patient with us as we're patient with you as well. Continuing with the law enforcement, we are seeing an uptick in our inmates. Our arrests are increasing, and we're making arrests for a variety of things. Sometimes it's survival crimes like we saw during the recession in 9 and 10, where folks are simply walking into grocery stores, stealing items, and walking out. We continue to see that problem at our big box stores and our grocery stores as well. Additionally, we see an increase in our behavioral health issues with an uptick in our Baker Acts, our law enforcement Baker Acts, and unfortunately we continue to see an increase in our domestic violence. We know and feel the frustration as everybody in the county, but I do know by staying together and sticking together, we'll be safe as usual. So thank you and enjoy your weekend.
All right, thank you, Sheriff. Good afternoon. And I want to thank the Sheriff and all of the law enforcement folks, the Sheriff's Office and our city PDs for helping us out, and also for our county residents for doing what you do and being the best county residents out there. And thank you to our fire rescue folks, our health department partners, and the healthcare workers, and everyone who has come together and responded the way Indian River County does to make the best out of this difficult event. Have some updates about county facilities. So as you know, earlier this week on Tuesday, all of the county, City of Vero, and Indian River Shores beach access points were open to the public, and all activities are allowed. However, we ask everyone to continue doing your social distancing, avoiding those crowds of 10 or more, keeping at least 6 feet apart from those other parties, things have gone well, as the sheriff can attest to, that we have had very few incidents on our beaches, and everyone is doing the right thing out there. So this is a testament to the commitment of our citizens, of our municipalities who we've been coordinating these openings and events with as well. We'll also reiterate that the county shooting range reopened this morning and is operating under enhanced cleaning procedures as well as the social distancing guidelines. Things are going well there, and that includes things like every other shooting station, things like that, to ensure the social distancing. I want to announce that we will begin the phase one reopening of the county's aquatic centers. That's the Gifford Aquatic Center and the North County Aquatic Center for lap swimming only. That will be Tuesday, May 12th. The North County Aquatic Center will open at 6 a.m. on Tuesday, and the Gifford Aquatic Center will open at 10 a.m. That will have lap swim only and 1 swimmer per lane, and we ask the swimmers to closely adhere to those CDC guidelines. Of course, there will be additional cleaning protocols in place there and extra measures to ensure that the physical distancing, I'm told to use physical distancing rather than social distancing. We can still be social, but be physically distant. Additionally, another announcement is that the county's Donald McDonald Campground will also partially reopen to the public on Monday and will operate under new guidelines to promote the social distancing and ensure increased cleaning and disinfecting throughout the campground. So only a limited number of campsites will be available in order to ensure that there's the distance between the different campers. The playground there will remain closed until further notice. However, the T-dock will be open and campground staff will be present to ensure that campers are practicing that safe physical distancing. The boat dock will remain open as well, and the campground's ranger's office will remain closed to the public, and no reservations will be conducted by campground staff. All reservations are to be done online through the county's Civic Rec reservation system, and you can find that by visiting ircgov.com/camping. Remember, the county, as well as our municipalities within the great county, are here for you, and we will continue to do all that we can to ensure that not only our residents remain healthy and safe, but that everyone is informed with the most up-to-date and accurate information. I want to thank our municipality partners. We've worked cohesively together as a unit, great collaboration with them to ensure that we have these similar things happening and there's not confusion amongst our residents. We continue under phase 1 per Governor DeSantis's order. I want to remind everybody to keep being smart as we have been. We're getting back to our new normal. That new normal involves the social distancing. Make sure that you're taking all these precautions, because the better we do with that, the better we'll be able to move forward and get to that new normal. With that, thank you. Be well and stay safe. And now I'll turn it over to Miranda Hawker.
Thank you so much, Jason. I just wanted to go over the case count, and then I can go in a few other items as well. So statewide, as of 11 o'clock, there are 39,199 cases, with 6,929 hospitalized and 1,669 deaths. Our current number of cases is 100, with 8 cases reported this week. There are 26 people with a history of hospitalization. The age range of our cases is from 8 to 94, with 56 men and 43 women and 1 unknown. Our deaths remains the same. We've had no additional deaths this week, so that has been good news. In terms of race and ethnicity for our Florida resident cases, 6 of our cases are Black, 62 are white, 14 are classified as other, and 7 are unknown. In terms of ethnicity, 6 individuals are Hispanic, and 66 are non-Hispanic, 17 are unknown, where we have no data on those individuals for ethnicity. In terms of the cases in nursing homes and ALFs, Harbor Chase, we've had 1 positive resident, 5 resident deaths, and 1 positive staff. Palm Garden Nursing Home has 2 positive residents and 2 staff positive. Sonata has 1 positive resident and 4 staff. And so the health department continues to provide that public education to those our vulnerable populations. In our long-term care facilities, we're supporting them each week and every day. So of course, all of our cases are self-isolating either at home or in the hospital. I do want to touch on what Jason had talked about. While some of our businesses in the county have reopened this week, people are out more than they've been out in the past weeks. It's important that those lessons that we've learned over these past 6 weeks, that people still are practicing that good social distancing. People are still maintaining that 6 feet, because it's easy to let our guard down when we see things starting to reopen, starting to get back to some level of normalcy. It's easy to think, oh, I can revert to my old behaviors, because we've had those for our entire life. But we need to, especially in this time, please be vigilant about your social distancing. Please be vigilant about your masks, because it helps Even if you're not at great risk for complications from COVID-19, anyone can have complications for COVID-19. But the healthier that all of us stay, the healthier that our people who are at great risk will stay, and that's important. So make sure you're cleaning your hands frequently with soap and water. Clean your hands frequently with hand sanitizer if soap and water isn't available, and avoid touching your eyes, nose, or mouth. If you're sick, stay home. If you are at risk for severe complications from COVID-19, stay home. Please do not only go out for those essential trips. That's going to keep you healthier. Make sure you call your doctor first if you have symptoms of COVID-19, and they'll evaluate you for illness and determine if you should be tested. The health department started its home testing project last week. So if people are interested in being tested at home and they are unable to leave their home due to illness or advanced stage, please call 794-7411. And so in terms of total tests the health department's done, it's 85, and we have the capacity to perform 269. Our total tests done in the county are 2,200, with 100 positive and 2,100 negative. And I'd like to turn things over to Corey Richter for his comments on the hospitals.
Thank you, Miranda. As I had said last week, the hospitals are gearing up now for elective surgeries, but you need to contact your physician and see what surgeries they are trying to start. I know they're doing it very carefully. They're not just opening the floodgates and starting to do everything. They're trying to do it very methodical and right to keep everybody safe from the COVID-19. So believe me, they're doing everything they can to do what they can, but without endangering the general public. As far as Cleveland Clinic, their total calls to their hotline, they've had 6,097 calls, 6097 calls to their hotline, an average of about 80 calls a day since they started. What they've tested is 2,571 tests they've done. Out of that, 2,483 have been negative, or about 96% of it. And 20 are pending at this time, and 68 are positive. There's only 4 in-house right now. So right now the numbers are still good as far as in-house patients. They've been going down. If you've been tracking my numbers for the last few weeks on Fridays, I think last Friday they were up to 5 or 6, I think 6 it was, and now they're down to 4. So that's getting better. That's a good sign. We just need to follow the social distancing, washing the hands, and everything in order to, or physical distancing, as they said. So now Sebastian, their testing numbers, 80. They've tested 80. 71 have been negative. 1 pending and 8 positive out of their testing results there. So that's all the testing results. The hotline, if you want to call the Indian River hotline, it's open 9 to 5, 7 days a week. It's 772-226-4846. That's 226-4846. Call the hotline and they screen you, and you can come in and get tested if you meet the criteria. You know, they've opened up their criteria based on the CDC guidelines. So a few more people should be able to be tested and in there. And I encourage people, if you have signs and symptoms, get with your own physician, obviously, first, but you can call them and get tested if you need to also. And that's all I have. We'll take questions, I guess. Right.
We'll open it up for questions. Anybody?
I did have a question for Jason Brown. Can you repeat the information you said about the openings of the aquatic facilities?
So yes, Nick, both Aquatic Centers, Gifford Aquatic Center and North County Aquatic Center will open on Tuesday morning. That's May 12th. The opening hours at North County are 6 a.m. and Gifford is 10 a.m. So they will be open for lap swimming only. The activity pools, splash pads will remain closed. That is one swimmer per lane as well. There will not be shared lanes. We have a whole protocol in place to ensure that the physical distancing stays in place.
Hi, Brittany
Yes.
Martinez with Channel 1098. Also a question for you, Jason. What contingency plans are there if any cases increase in the next month?
Well, I think the approach that we're taking is a data-driven approach, like the governor's doing. As we open these things and move through phase one, if you look at the White House criteria, there's gating criteria. You've got to show that you're not having an increase in cases before you move forward. So we're monitoring those statistics and getting information from our partners at the health department to ensure that if there is some kind of increase that we would adjust ourselves accordingly.
Okay, and then you already know those things that you need to put back in place, the restrictions?
Yes, we would make all of our decisions based on the most current information at hand. So we are doing this in a methodical, step-by-step process, and if an adjustment needs to be made, we are prepared to make those adjustments.
Okay, thank you.
Do you have any idea what the next phase after you've got the Aquatic Centers that's opening up next week? Any other things that are going to be open, like offices?
I don't foresee significant additional openings during phase one. So we have a local, we have been doing our local planning in 3 phases, like the White House plan, like the governor's plan that the governor seems to be following and that the task force followed, phase 1, phase 2, phase 3. With these openings on Tuesday, I believe we won't have any significant additional openings until we get to phase 2. When it may make sense to open additional facilities.
Are you following the governor's phase 2? Okay. Any plans for when phase 2 is going to start?
Right, so we're just monitoring that. My understanding, if you look at the White House guidelines, I believe it's 14 days of continued declines in cases in phase 1 prior to entering phase 2. So we are using that as our planning. And we will go to phase 2 as the time is appropriate and as the governor makes a determination on that.
I know I did have a question. Can you talk more about the additional cleaning at the Gifford Aquatic Center and the North County? Will that be in place?
Yes, so we have multiple cleanings of restroom facilities and all of those high-touch surfaces, and we have additional staff that has been displaced from their regular work, and we're reassigning those folks to ensure that. So in each of these openings, we are applying additional staff from what you would normally have at a facility to A, ensure social distancing, B, to reinforce the additional cleaning and sanitation that's needed.
Okay. And did you say that the county's campground is going to open?
Yes, at Donald McDonald Park. The county
Oh, okay.
campground.
McDonald Park?
Yes, yeah, Donald McDonald along the St. Sebastian River has a campground. I think there are 26 primitive campsites and I think 5 RV campsites. We will have every other one of the primitive camping sites open, and the others will be closed to help with that social distancing.
Okay. And what time will that open on Monday?
At the normal operating hours.
Okay. Gotcha.
Thank you.
There are no questions. Thank you again, everybody, for joining us. We will reconvene next Friday afternoon for our 3 p.m. Press conference. Have a great weekend.
Thank you, guys.